Good morning, everyone. Let's go ahead and start. We have limited time this morning, so with that, I hid my gavel. We'll call the meeting to order. Please call the roll.
Assemblywoman Benitez Thompson. Assemblyman Frierson. Assemblywoman Gorlow.
Here.
Assemblyman Hafen. Assemblywoman Howdigy.
Here.
Assemblyman Levitt. Assemblywoman Miller.
Here.
Assemblywoman Monroe Moreno.
Here.
Assemblywoman Peters.
Here.
Assemblyman Roberts.
Here.
Assemblywoman Titus.
Here.
Assemblywoman Tolles.
Here.
Assemblyman Watts.
Here.
Chair Carlton.
And I am here. Thank you very much. With that, let me make sure I've got everything I need. Okay, so you see a lot of bills that are posted, and that's typical for this time of year. Whatever we don't get to today will roll till tomorrow. The first things on the agenda today are to finish the couple of ABs that are still left hanging because those still have to make it through the second house. So we have to prioritize them first. We have the CIP and pay bill that we need to move to make sure that that gets to where it needs to be so we can fund government. And then we have what we call our parking lot bills, the Senate bills that we've already heard. We passed K-12 last night. We can now shove all those Senate bills back out so that they can get finalized. And then we will start processing individual members' bills. I plan on trying to take it from the top of the order as much as possible. I know the Senate Chair of Human Resources has a number of bills here in here. We'll try to get us a couple of those done, and then we might have to roll a couple till tomorrow. We only have a little less than 2 hours this morning because we have to be on floor at time certain for a presentation today. So with that, I'm going to go ahead and do the work session first so we can get things processed. The first thing on work session would be to finalize AB 432, the fiscal notes from last night. So I'm going to go ahead and ask Ms. Kaufman to do AB 432. That was Mr. Watts's bill that the fiscal notes we couldn't get to last night. We need to have the hearing on 432.
Thank you, Madam Chair. Assembly Bill for,
But we need to have the hearing on
Oh.
432 first. So are you ready? Okay. But we did get the fiscal notes last night, so now we are aware of what they are, so we can go ahead and have the hearing.
Good morning, Madam Chair, members of the committee. For the record, Howard Watts, representing Assembly District 15 in Clark County. I am happy to present Assembly Bill 432 to you today, which expands our automatic voter registration system in the state. Essentially, there are two aspects to the bill. One is expanding the agencies that will or can become automatic voter registration entities. Currently, we have the DMV. This would extend it to cover the Silver State Health Exchange, as well as our Medicaid system. In addition, it makes various changes to the automatic voter registration system at the DMV to further streamline the process, which has the ability to generate cost savings. In regards to the fiscal notes from the bill, you'll note that the DMV does project to see some cost savings once this is implemented. The bill was amended to push out the implementation date to January 1st, 2024. As a result, there are two new unsolicited fiscal notes which indicate that there will not be a cost to implement during this biennium. That change was also made to help align this policy with the implementation of the top-down voter registration system, which this committee handled, I believe, yesterday. With that, I know that the Secretary of State's office still has a fiscal note. I see Mr. Voloshin is on the line, and that's my summary. I'm glad to answer any questions that you may have, and we'll let Mr. Voloshin speak to the Secretary of State's fiscal note.
All right, since this is the hearing on Assembly Bill 432, I'll go ahead and ask the Secretary of State's office to speak to the fiscal note only, and then when we get to support, opposition, and neutral, be happy to come back to you for conversation within that. So, go ahead, please.
Thank you. Good morning, Chair Carlton and members of the committee. Mark Voloshin, Deputy Secretary of State for Elections, for the record. And this fiscal note identifies the cost of personnel required to develop and implement the system, similar to the implementation of the DMV AVR project. Similar to the other fiscal notes submitted by the Office of the Secretary of State, it reflects not a worst-case scenario nor a best-case scenario, but the most realistic scenario, given the information we had available at the time of drafting. While a recent amendment did change the date the bill will be effective, it does not change the total fiscal impact to the state, but may shift some small portion from this biennium to the next. That being said, I'm available for questions. Thank you for your time.
If you could walk through the fiscal note, please. Thank you.
Yes, ma'am, certainly. The fiscal note identifies a requirement really just for personnel. Again, the bill identifies a requirement for the Office of the Secretary of State to create a similar portal to the one that had been established for the DMV. It will have to be a different portal, and the idea, as Assemblyman Watts had mentioned just a moment ago, is to integrate the system into the top-down voter registration system that is also underway, the implementation of. This bill specifically calls for 2 permanent FTE employees, as well as a number of contracted employees. Specifically, the number is 4 contract employees that will be hired for a temporary period of time to begin the implementation in this biennium. Again, the development, resource gathering, the identification of stakeholders across the state to make sure that we have all of those resources and requirements identified as we move in from this biennium into the future ones, in order to meet that implementation date of January 1st of 2024. The 2 FTE positions that we've identified, one is an IT position, it's a business process analyst, and the other is a program officer to monitor the system on a full-time basis. Again, both of those positions were identified based on our experiences with the DMV AVR project. Thank you.
And thank you very much. We just want to make sure we have a complete record. So with that, Mr. Watts, did you have anyone else you'd like to testify?
There's no one else at this time, Madam Chair. So if you have any questions, I'm glad to answer them.
Sometimes that's a good thing, sometimes it's not.
Yeah.
We'll consider it as a good thing right now. So with that, thank you very much for the presentation. We will go ahead and open it up as the hearing part. This is the hearing for AB 432. So we'll go to support, opposition, and neutral. Is there anyone in the room in support of AB 432? Please come forward. There are 2 chairs. If you're comfortable, please come up 2 at a time.
Morning, Chair and members of the committee. For the record, my name is Maria Teresa Lieberman Barraga, and I am the Deputy Director of Battleborn Progress, and we are here in support of Assembly Bill 432 and ask that you support this investment for expanding automatic voter registration in Nevada, because any time that we can expand ways to register to vote is a worthwhile investment. Thank you for your time.
Thank you very much. Anyone else in the room in support? Not seeing anyone else in the room in support, we'll go to the Zoom. Seeing no one wishing to be recognized in support, we'll go to the phone line. Is anyone on the phone line in support?
If you would like to testify in support on AB 432, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 201, please slowly state and spell your name for the record. You will have 2 minutes and may begin. Caller 201, please press star 6 to unmute.
Good morning, Chairwoman Carlson and committee members. For the record, my name is Emily Prasad Zamora. I'm the Executive Director of Silver State Voices, and I'm here in strong support of Assembly Bill 432. Funding more methods in which eligible voters may register to vote is imperative in order to ensure that we are welcoming greater participation in our electoral process among all Nevadans. We ask that you invest in our democracy by voting yes on AB 432. Thank you so much for your time.
Thank you. Is there another caller?
Chair, there are no more callers in support at this time.
Thank you. Is there anyone in opposition in the room? Seeing no opposition in the room, opposition on Zoom. Seeing no opposition on Zoom, opposition on the phone line, please.
If you would like to testify in opposition to AB 432, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you very much, Broadcast Services. Anyone in neutral in the room? Seeing none, neutral on Zoom. Secretary of State's office, are you in neutral?
Yes, ma'am.
Please
Thank you.
proceed.
Mark Voloshin for the record. The Office of the Secretary of State is neutral on Assembly Bill 432. Thank you.
Okay, thank you very much. Anyone in neutral on the phone line, please?
If you would like to testify in neutral on AB 432, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 651. Please slowly state and spell your name for the record. You will have 2 minutes and may begin. Caller with the last 3 digits, 651. Please press star 6 to unmute.
Sorry about that. Good morning. Julie Balderson, that's BALBERSON for the record, with Welfare and Supportive Services. Wanted to get on the record this morning that based on the change in the timeline for implementation, we have removed our fiscal note for this biennium. Thank you.
And thank you very much for being on the line. We appreciate that. Is there anyone else on the phone line, please?
Chair, that was the last caller in neutral.
Thank you very much. Mr. Watts, any closing comments?
Yes, thank you, Madam Chair, members of the committee. Howard Watts for the record. I'll be very brief. I would just note that, again, with the implementation timeline being pushed out 2 years, I don't see there being a need for I agree that there is a need for staffing to implement this project. I don't think there's a need within the fiscal year 22 to begin that process. And the other thing that I would note is that there already has been a working group established to implement and monitor automatic voter registration at the DMV that I believe can be successfully built upon for the expansion of the system contemplated in this bill. So I think there's a little bit of a disagreement along the timeline in regards to the Secretary of State's fiscal note and any adjustments that would result from the amendment that has been provided to the bill. Otherwise, thank you all for your time and consideration today.
Thank you very much, Mr. Watts. We'll go ahead and close the hearing on Assembly Bill 432. So committee members, last night a bill was taken from Leg Ops AB 65 and it was referred to our committee. It's my understanding that there is an amendment trying to make its way from the first floor to the third floor. So we won't be discussing AB 65 until we actually have the amendment, because I believe the amendment does a lot of changes. So there would be no reason to have conversation about it until we can review the amendment and have a thorough conversation. So AB 65, for those that are listening, if we get the amendment, I'll be happy to put it on the agenda for tomorrow. But I have not seen the amendment, and we really can't talk about it till we do get the amendment. So that's what we're waiting on. So with that, folks, we're going to go into a work session so we can get stuff moved. We're going to try to do as much of that as we can, and then we'll go from there. So with that, Ms. Kaufman, if we go ahead and get CIP and pay bill done, and then empty.
We have to do a hearing on it first.
Okay. With all the confusion, we need to do hearings on those, so rather than do hearings at this moment, we're in good shape with those right now. let's just get the parking lot emptied out to make sure all these Senate bills get to the assembly floor and get finalized. So with that, Ms. Kaufman, if you'll just walk us through, and committee members, we heard these a while ago, but these are the ones that I told you were going into the parking lot. Okay, so with that, let's go.
Thank you, Madam Chair. Senate Bill 410 makes a general fund appropriation of $18,643,998 to the Central Repository for the Nevada Records of Criminal History, for the Department of Public Safety, for the continued cost of modernization for their Nevada Criminal Justice Information System, otherwise known as NCJIS. Fiscal staff worked in consultation with the agency and the Governor's Finance Office and identified $3 million available in reserves that could be applied towards the modernization project. Therefore, the general fund appropriation could be amended to $15,643,998.
Okay. So this would be an amend and do pass, correct? So with that, committee members, are there any questions at this time on SB 410? Hearing none. I'll take a motion from Ms. Monroe Moreno, second from Speaker Frierson. Any questions or comments? Hearing none. Mr. Roberts.
Thank you, Madam Chair. And so this is direly needed. The system is outdated, and it is definitely a must, and I look forward to supporting this
Thank
here
you.
and on the floor.
Yeah. So with that, no other questions or comments on SB 410. Motion and a second. All those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously, the members present. Next bill, please, Ms. Kaufman.
The next bill is Senate Bill 411, makes a general fund appropriation of $379,541 to the Department of Public Safety for the replacement of computer hardware for both their Division of Parole and Probation as well as the Investigations Division.
No amendments,
There are no amendments.
no adjustments, so this would be a due pass. Any conversation before I accept a motion? Seeing none, I'll take a motion from Ms. Monroe Moreno, second from Speaker Frierson. Any comments? Hearing none, all in favor, please signify by saying aye. Aye. Any in opposition? Hearing none, motion passes. Next bill, please.
Madam Chair, the next bill is Senate Bill 412. It makes a general fund appropriation of $53,550 to the Department of Agriculture for new laboratory equipment and maintenance contracts related to veterinary medical services, and there are no amendments recommended.
So with that, committee members, any questions? Questions? Not seeing any questions. This would be a due pass. I'll accept a motion from Ms. Monroe Moreno, a second from Dr. Titus. Comments? Hearing none. All those in favor, please signify by saying aye. Aye. Any in opposition? No opposition. Passes unanimously. The members present. Next bill, please.
Thank you, Madam Chair. Senate Bill 413 appropriates $5,409,619 to the Nevada Gaming Control Board to fund the continued costs of the Alpha Migration Project replacement and modernize the Gaming Control Board's information system over the 2021-23 biennium, and there are no recommended amendments.
So committee, this would be a due pass. Any questions? Hearing none. I'll take a motion from Ms. Monroe Moreno, second from Dr. Titus. All in favor, please signify by saying aye. Aye. Any opposition? Hearing none. Passes unanimously. The members present. Next bill, please.
Thank you, Madam Chair. Senate Bill 414 makes a general fund appropriation of $2,943,463 to the Department of Taxation for the continued cost of modernizing the unified tax system as part of the Project Mint.
Okay. No amendments? Thank you very much, Ms. Kaufman. Any questions from the committee? Hearing none, I'll accept a motion from Ms. Monroe Moreno, second from Dr. Titus. All in comments? Hearing none. All in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously. The members present. Next bill, please.
Senate Bill 415, as amended, appropriates general fund appropriations of $632,854 to the Department of Taxation for the relocation and consolidation of 2 offices in Las Vegas Valley and to 1 office in Southern Nevada. So this would be due pass as amended.
Do pass as amended. Are there questions or comments?
We don't, I apologize for that. We don't recognize the amendment on the Senate side, so it would just be a do pass.
Just a do pass. So there's no significant changes as far as we're concerned. Do pass. So with that, to accept a motion from Ms. Monroe Moreno, second from Dr. Titus. Any questions or comments? Hearing none. All in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimous to the members present. Next bill, please.
Madam Chair, Senate Bill 418 makes a general fund appropriation of $422,000 to the division of, the budget division of the Governor's Finance Office for the continued replacement of upgrade of the Nevada executive budget system. And there are no amendments on this bill.
This one would also be a do pass. Any questions from the committee? Hearing none, I'll accept a motion from Ms. Monroe Moreno, second from Dr. Titus. All in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. The next bill, please.
Thank you, Madam Chair. Senate Bill 426 makes general fund appropriations of $1,784,500 to serve as a loan to the Division of Emergency Information Technology Services of the Department of Administration for the replacement of content management and portal platform. The bill requires the division to provide annual installments of 25% of the cost of the replacement of the platform beginning July 1st, 2023, and there are no recommended amendments.
So committee members, this would be a do pass. Any questions or comments? I would have never thought we'd be spending this much money on technology. This is just amazing. So with that, hearing no other comments, I'll accept a motion from Ms. Monroe Moreno, second from Dr. Titus. Any questions or comments? Hearing none, all in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. Next bill, please.
Thank you, Madam Chair. Senate Bill 427 makes general fund appropriations totaling $766,561 to the Division of Child and Family Services, the Department of Health and Human Services, for deferred maintenance projects for Summit View Youth Center, Caliente Youth Center, Nevada Youth Training Center, and the Southern Nevada Child and Adolescent Service Campus. There are no recommended amendments.
Thank you very much. Any questions, committee members? Seeing none, the motion would be a do pass. I'll accept the motion from Ms. Monroe Moreno, second from Dr. Titus. Comments? Hearing none. All in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. The next, do we have another one? Oh, give us just a second, but nobody get out of your chairs. Right, committee, I believe we've got the first wave done so that we can get those down to the floor and get those processed. There's still a lot more, but we'll do them a piece at a time to make it easier to get them all processed and just try to keep an even flow going to the floor. So with that, I believe we can go ahead and go back into, oh, I apologize. I would like to go ahead and move Assembly Bill 432, please. And get it to the floor. Ms. Kaufman.
Thank you, Madam Chair. Assembly Bill 432, as amended, provides certain agencies of the Executive Department of the state government to excuse me, I'm sorry, let me start over again. AB 432 as amended provides that certain agencies of the executive department of the state government are provided for automatic voter registration agencies. It authorizes the governor to designate additional state agencies and certain tribal agencies as automatic voter registration agencies, and sets forth the requirements of an automatic voter registration agency to transmit certain voter registration information to the Secretary of State, the county clerk. I would note that there were two original fiscal notes. SHIX, the Silver State Health Exchange, originally had a fiscal note of $4.1 million in 2022 and $937,253 in 2023. However, an unsolicited fiscal note was submitted last night indicating that there would be no fiscal impact for this biennium. However, in the future biennium, it would be approximately $4.9 million. The Division of Welfare and Supportive Services also had a fiscal note of $3.2 million in fiscal year 2022. However, with the delay of implementation, they removed their fiscal note. The Division of Motor Vehicles indicated that they would need $48,233 for programming hours related to the automatic voter registration, and the Secretary of State has provided a fiscal note of $736,391 in fiscal year 2022 and $346,439 in fiscal year 2023 for various positions related to the maintenance and upgrades of the automatic voter registration system.
Can I see that one document, please? real quick? Just make sure I got it right. They're not implementing it next year, but they're going to incur those costs right now. Alrighty, I just had to review that again one more time. There's too many of them been moving around. So committee members, are there any questions at this time? A couple of the fiscal notes have been removed, but the one from the Secretary of State still stands. We are going to go ahead and process it with that fiscal note, but I believe there will be future discussions as this bill moves from the south end of the building to the north end of the building, and those conversations will continue. So with that, committee members, are there any questions on Assembly Bill 432 at this time? Not seeing any, so with that, I believe it is a so it would be an amend and do pass as amended with the fiscal components amended in. Any questions? Seeing none, I'll accept a motion from Ms. Monroe Moreno, a second from Speaker Frierson. Any questions or comments on the motion? All those in favor, please signify by saying aye. Aye. And those in opposition? I have Dr. Titus, Mr. Hafen, Ms. Tolles, Mr. Lovett, and Mr. Roberts in opposition. Motion passes. We'll go ahead and move this to the floor and go from there. Thank you very much. So that takes care of the work session that we are going to be doing this morning. We can go ahead and get into some bills. Just a few minutes behind, no problem. So with that, it would be the chair's intent to prioritize SB 5, SB 40, SB 290, I'm just trying to group them together for the folks that are here so that we don't have to go in and out, but that'll probably end up having to happen eventually. Let's start with so those will be the three bills that we are here. We're going to process the CIP bill and the pay bill, do a very quick hearing on those so that we can get those moved to the floor. And then we'll bring up those first three bills and then we'll go from there. So with that, Ms. Kaufman.
Thank you, Madam Chair. Assembly Bill 492 is the CIP bill, relates to projects of capital improvement, authorizes certain expenditures by the State Public Works Division of the Department of Administration. It levies a property tax to support the consolidated bond interest and redemption, and makes various appropriations.
Thank you very much. So this is the hearing on Assembly Bill. Assembly Bill 492. We hear them backwards. It always gets confusing. So with that, I'll go ahead and open up the hearing. Is there anyone in the room here in support of Assembly Bill 492? Yes, please.
Kent Irvin, Nevada Faculty Alliance. We appreciate the funding for the UNLV engineering building, the welding lab at GBC, and the other items for NSHE. Thank you very much.
You're welcome. Anyone else in support in the room? Not seeing anyone in support in the room, seeing no one on Zoom. Broadcast Services, is there anyone in support on the phone line, please?
Chair, what was the bill? I got lost there for a second.
You and me both, Broadcast Services. AB 492.
492. Thank you so much.
You're welcome.
If you would like to testify in support on AB 492, please press star 9 now to take your place in the queue. Caller with the last three digits, 853, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Doug Unger, D-O-U-G-U-N-G-E-R, UNLV Chapter President and Southern Nevada Government Affairs, Nevada Faculty Alliance. We would like to express our strong support for AB 492 and all the good provisions for UNLV and Southern Nevada that it contains. Thank you.
Thank you very much. So with that, anyone else in support, please, Broadcast Services?
Chair, that was the last caller in support.
Thank you very much. So with that, is there anyone in opposition in the room? Seeing none, no one on Zoom. Broadcast Services, anyone in opposition on the phone line?
If you would like to testify in opposition to AB 492, please press star 9 now to take your place in the queue. Chair, there's no one on the line to testify in opposition at this time.
Thank you very much. Is there anyone in the room in neutral on Assembly Bill 492? Seeing none, no one on Zoom. Is there anyone in neutral on the phone line, please?
If you would like to testify in neutral on AB 492, please press star 9 now to take your place in the queue. Chair, there are no callers of the line on neutral at this time.
Thank you very much. So with that, I believe we can close the hearing on Assembly Bill 492. It's the chair's intention to move the bill right now. Are there any questions and concerns on our CIP bill? Seeing none, I would accept a motion to do pass from Speaker Frierson. Dr. Titus, did you have a question? I'm going to make a comment after. Okay, are you the second? I have a motion from Speaker Frierson, a second from Vice Chair Monroe Moreno. Going to comments, Dr. Titus.
Thank you, Madam Chair. I will support this out of committee with the right to change my vote. Thank you.
Okay, thank you very much. So with that, committee members, are there any other conversation? Seeing none, all those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members at this moment in time. So with that, we'll move on to the pay bill, which is Assembly Bill 493. I probably should have been able to guess that. 493. Go ahead.
Thank you, Madam Chair. Assembly Bill 493 establishes the maximum allowed salaries for certain state employees and makes appropriations from the general fund and the state highway fund for increases in salaries of certain state employees.
With this is the bills, how we pay people for the next couple of years. So with that, committee members, are there any questions or, oh no, this is the hearing on Assembly Bill 493. So with that, I'll go ahead and open up the hearing on Assembly Bill 493. Is there anyone in the room in support of Assembly Bill 493? Not seeing anyone come forward. Anyone on Zoom in support? Not seeing anyone wishing to be recognized. Is there anyone on the phone line in support of Assembly Bill 493?
If you would like to testify in support on Assembly Bill 493, please press star 9 now to take your place in the queue. Chair, there's no one on the line to testify in support at this time.
Thank you very much. Is there anyone in the room in opposition? Seeing none, oh,
Kent Irvin, Nevada Faculty Alliance, and of course we support paying our state employees. I just have to put on the record that the 1% COLA in FY23 only is inadequate to account for inflation, since our last COLA in July of 2019, the Consumer Price Index has increased 4.6% through April. Over the last 10 years, inflation has been 22%, and the accumulated state COLAs have been 12%, so that's a net 10% loss in purchasing power. And then the disparity between the 3% COLA for those in bargaining units who reached agreements with the state and the 1% for all other state employees will cause real policy and compensation issues long term. So I just ask you to fix that as this process goes forward. And it's particularly unfair for those of us who are excluded by statute in NRS 288 from being in one of the state bargaining units. So we did not even have the opportunity to bargain or reach an agreement with the executive department in order to gain a higher COLA. Thank you very much.
is there anyone else in the room in opposition to the bill? Hearing none, there is no one on Zoom broadcast services. Do we have someone in opposition on the phone?
If you would like to testify in opposition to AB 493, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 853, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Doug Unger, D-O-U-G, U-N-G-E-R, UNLV Chapter President and Southern Nevada Government Affairs Representative, Nevada Faculty Alliance. I would like to point out to the Ways and Means Committee and to Chair Carlton that faculty salaries are now 15% below the national average, whereas they were in 2008 15% above the national average. The 1% COLA, which would affect NC faculty, will, in essence, drive our salaries down another 2% over the next 2 years. We hope that this can be fixed. Salary and PEP benefits are the 2 most pressing issues among our faculty, and in order to hire and retain quality teachers and scholars for the Nevada system of higher education, we would request a reconsideration of the 1% and raising it to the extent that you deem prudent and possible. Thank you very much.
Broadcast services, is there anyone else on the phone line?
Chair, that was the last caller in opposition at this time.
Thank you very much. Is there anyone in neutral in the room? Seeing none, there's no one in neutral on Zoom. Is there anyone in neutral on the phone line?
If you would like to testify neutral on AB 493, please press *9 now to take your place in the queue. Chair, there is no one to testify neutral at this time.
Thank you very much. So with that, I believe we've taken care of all of the testimony that needs to be done. Mr. Haven, did you have a question?
Thank you, Madam Chair. I just, based on the testimony, I had a question about how the 1% versus the 3% was going to work. I think I understand INCHE does not have a CBA, and therefore they're at the 1%. But if there are individuals in an agency, and the agency has a collective bargaining agreement, but that individual is not part of that, are they subject to the 1%, or are they subject to the 3%? As with the whole agency?
I'll let Ms. Kaufman go, but then I think I have an idea too. Go ahead.
Thank you, Madam Chair. Those who are in the collective bargaining unit get the 3%, and those who are not in collective bargaining would get 1%. So you may have instances where individuals are in the same agency, but if they're not in the collective bargaining units, their COLAs will be different.
And thank you for that clarification. I appreciate it.
And as we were walked through yesterday, all the different categories, the 3%, the 2% plus whatever the state does, those individual units have gone ahead and bargained, got their process through the Board of Examiners by the May 25th deadline. Moving forward, there are still others in that process. They just didn't make it by the deadline, so who knows? You all may see some of those next year when we have this, when you have the same conversation. So with that, I believe we can go ahead and process the bill. So at this time, the chair would accept a motion to process AB 493. It would be a due pass. I'll take a motion from Ms. Monroe Moreno, a second from Speaker Frierson. All those in favor, please signify by, get that hand up there. I'm not going to know.
Thank you, Madam Chair. I will be a no on this. I know we need to pay our employees, but during the hearing and again this morning, the complete disparity in what I would say is not fair to our employees is just very evident to me. On the fact that we allow, whether you're pro-union or non-pro-union, that's not the conversation. The conversation is that some agencies can negotiate for their members, others cannot. If it forces you to join a union, you may not be for the union, then all of a sudden now this person who has this 3% increase, you only get 1% increase. I just feel there's some significant concern there, so I cannot support this as submitted. Thank you.
And thank you, Dr. Titus, but I think it's important that we clarify that the issues that you have a problem with were in the collective bargaining bill, not actually encapsulated in the pay bill. Those things were voted on, decided, and debated in the actual collective bargaining bill. And different agencies and different groups have had the opportunity to move forward. So that conversation really was there, not here. We're dealing with what's right in front of us right now, and nobody's surprised where I come from. You know, if you want to negotiate that bargaining agreement and it gets through the Board of Examiners, I feel it's our responsibility to have a serious conversation about what those numbers really are, to make sure that they fit where we need to go, and that we process what has been done. So with that, where was I with this? Motion, second, conversation, other conversation. Mr. Roberts.
Thank you, Madam Chair. You know, and I was, as a government employee, I was involved in collective bargaining, you know, my whole career, and we had appointed employees. And typically, when the leadership, you know, we had collective bargaining agreements, typically we would align appointed employees at the discretion of the agency head with those raises. This COLA is not fair, and so therefore I'll be a no.
Okay, thank you. So the opposition is more about the 1% for everyone else than the 2 or 3% for the actual bargaining units. That's where the opposition, I just want to make sure the opposition is very clear that you're not opposed to the actual negotiation of the 3 or 2%. You're opposed to the 1% for everybody else.
Correct.
Okay, good.
Thank
Just want to make sure, had it on the record, because we haven't heard that bill yet, so. Ms. Tolles.
Thank you, Chair. And just to be clear, because this is written into this bill and this statute, in the case that my colleague, Assemblyman Roberts, just laid out for us, it prohibits an agency from being able to choose to raise it to 3% because it's our state. It's our
We've
state.
kind of strayed from work session. These
Okay, sorry,
questions
I'm sorry.
probably should have been more when we actually had the hearing on
Okay.
the bill. I think we made everything clear, walked through it, enunciated every single category that was getting it. Those, I believe, were questions more about then, but if there's, Ms. Tolles, what is your actual question?
It's that there's no room for them to negotiate on top of it for those non-collective bargain.
If you do not have a collective bargaining agreement, if you are not in a category
Okay.
that encapsulates, remember, we are a right-to-work state. You will get representation whether you pay your dues or not. So we do have freeloaders in this state within collective bargaining agreements. If you are in that category, you will receive these dollars whether you pay dues or not. But if your bargaining unit, if you have not created a bargaining unit and gone to the table and negotiated and got it through the Board of Examiners, then it doesn't exist. We are waiting for Cat 1 police officers to finish their process. We look forward to that happening in the next 2 years.
Okay.
So I think you have to encapsulate all of the collective bargaining agreement statutes. And remember, I'll say it again, we are a right-to-work state. You do not have to join a union to get those benefits. We do allow freeloaders in this state. So with that, are there any other questions or comments?
Just, I share the same concerns with my colleagues about that disparity, so I'm also a no. Thank you.
You're welcome. And it is the 1% disparity that is the concern. I just want to make sure that that's where it actually lies. So with that, hearing no other conversation, all those in favor, please signify by saying aye. Aye. And those in opposition would be Dr. Titus, Mr. Hafen, Ms. Tolles, Mr. Levitt, and Mr. Roberts. All right, so with that, we'll go ahead and send the pay bill down to we'll report that out to the floor. Okay, with that, I believe we can go ahead and go into some bill hearings. Ready, Ms. Kaufman? Okay, so with that, I indicated we would work on SB 5, but unfortunately, the majority leader is not here, and she's very interested in this bill. So we're going to skip SB 5 for the moment and move on to SB 40. So we'll go ahead and address SB 40. As is typical this time, we have members coming and going from different rooms. So, good morning.
Good morning, Chair Carlton, members of the committee. My name is Sarah Shulhagian. I'm here on behalf of Nevada's Patient Protection Commission. I serve as the executive director. I will try to keep my brief overview brief and go straight into the fiscal note. Who is joining me today? I have Miss Sandy Rubalid on Zoom and Miss Ellen Crecilius, and also in the audience is Miss Laura Rich from PEB. Senate Bill 40 is a measure that is seeking to implement several transparency measures to help better understand data trends in the healthcare industry. Specifically, this bill requires DHHS, to the extent that federal money is available, to establish an all-payer claims database of information relating to health insurance claims resulting from medical, dental, or pharmacy benefits provided in Nevada. Any public or private insurer that provides health benefits and is regulated under state law must submit data to the database, and insurers regulated under federal law can voluntarily submit data. In addition, Senate Bill 40 requires DHHS and the Division of Insurance and the Department of Business and Industry to submit a report to the Patient Protection Commission and the Legislative Committee on Healthcare regarding the types of reported data that could be used to analyze trends in the cost of healthcare, consolidation among healthcare entities, and other issues related to access to care. Last, Senate Bill 40 authorizes the Commission to request not more than 2 reports per year concerning price cost consolidation and access to care from state or local government entities. Any of those reports must be submitted to the executive director of the PPC and also to the attorney general. And so long as the agency has the resources to comply, and also so long as the requested information does not violate any HIPAA laws. Madam Chair, in the second reprint of the bill, with the adopted amendment 723, section 19.7 makes an appropriation to DHCFP for the development of an APCD. And if there is no further questions related to the policy, I would like to turn it over to Ms. Ellen Crecilius and Sandy Rubelid to talk about the fiscal note.
Thank you very much, and it's nice to see you in person, even though we miss seeing Ace on Zoom. So with that, ladies, proceed.
Ellen, would you like to go over the fiscal note?
Sure, I can walk through it. Ellen Crecilius for the record. So for the fiscal note, we updated our previous analysis to pull out some costs that we thought we may be able to live without. We pulled out the staffing costs. We're anticipating that we're going to be able to cover the project with current staff. Also, the Medicaid data extract we pulled out because we believe that we can cover that with our current budgeted enhancement hours. So the fiscal note continues to include the cost of the development of the database, the contract for RFP assistance, and the regulations. And I believe that the appropriation fully offsets the general fund need for this.
And I apologize, you broke up for just a moment. You believe the appropriation offsets? It cracked a bit for me. I didn't hear you. I'm sorry.
Yes, Ellen Crecilius, I believe that the appropriation fully offsets the general fund need that we put into the fiscal note.
Okay, thank you very much. So with that, anyone else?
Chair Carleton, if I can, I would like to have Ms. Sandy Rubelid also speak upon the federal dollars that would be coming in through the No Surprises Act. So if I could have her just go on the record and explain to the committee the federal dollars that are anticipated.
Okay, thank you. Please, go ahead.
Good morning, Chair and members of the committee. Sandy Rubelid for the record. I'm the Chief IT Manager for the Department of Health and Human Services. So we have the opportunity to draw down 90% federal dollars for the planning and implementation phase of the project because this has been delegated to the Medicaid agency from the department. Additionally, we have the opportunity to get a grant for $2.5 million over a 3-year period under the No Surprises Act that we believe will cover the implementation. And operations is also available to be funded for the percent of the population that can be attributed to Medicaid at 75% federal. So I'm happy to answer any questions.
Thank you very much. Anything else?
Chair Carlton, the only thing I'd like to note, Sarah Schulhagian for the record, is the No Surprises grant is perceived as a non-competitive grant. And to my understanding, and Sandy can confirm this, there is going to be a priority set on states that have have allowed for ERISA plans who voluntarily submit data into the database to take priority in the grant receival process, and this bill includes language that allows for that volunteer submission too.
Thank you very much, Ms. O'Hagan. We appreciate that. So committee members, are there any questions of the presenters on SB 40? Not seeing any questions. I've had many encounters with the all-payer claims database this session, so I got to learn about it very early by total accident. So I don't see any other questions. This is the hearing on SB 40. So we'll go ahead and open it up for the hearing portion of the bill. So is there anyone here in the room in support of SB 40? Not seeing anyone else come forward. Is there anyone on Zoom in support? Seeing no one being recognized. Is there anyone on the phone line in support of SB 40?
If you would like to testify in support on SB 40, please press *9 now to take your place in the queue. Chair, there are no callers on the line in support right now.
Thank you very much. Is there anyone in opposition in the room for SB 40? Seeing none, no opposition on Zoom. Is there anyone on the phone line in opposition?
If you would like to testify in opposition to SB 40, please press star 9 now to take your place in the queue. Chair, there's no one on the line to testify in opposition at this time.
Thank you very much. So with that, opening it up for neutral. Any neutral here in the room? Seeing none, no one on Zoom. On the phone line, anyone in neutral?
If you would like to testify in neutral on SB 40, please press star 9 now to take your place in the queue. Chair, there is no one on the line to testify in neutral.
Thank you very much. So with that, Ms. Shohagian, any closing comments?
Hi, Sarah Shulhagian for the record. I just want to thank you for your consideration and acknowledge all the tremendous work that has gone into this bill from the inception, coming out of the Patient Protection Commission. Most notably, I'd really like to thank Chair Khan for his efforts in his leadership, and Senator Ratty for her tremendous leadership on the Senate side, and for your continued consideration. Sincerely appreciate it and think this will go a long way to help us understand healthcare and what we can do to improve upon it.
And thank you, Ms. Shohagian, and thank you for all of your work that you did keeping the Patient Protection Commission on track and working through a pandemic cycle as you were trying to set it up. And again, I'd like to thank Dr. Khan for all of his hard work that he did to make sure that this commission, it's very near and dear to me. So thank you for all the work that you've done. We do appreciate it. So with that, we'll go ahead and close the hearing on SB 40. And since Majority Leader is here, I believe we can go ahead and have the hearing on SB 5. So with that, we'll go ahead and open up the hearing on SB 5 and invite Ms. Shohagian right back again.
Thank you so much, Chair Carlton, members of the committee. My name is Sarah Shulhagian. I am here today on behalf of Nevada's Patient Protection Commission. I serve as the executive director. On Zoom, and who's joining me today is Deb Reynolds from DPBH and Deputy Director Dwayne Young as well. Senate Bill 5 is a measure that makes various changes to telehealth and really is an effort to recognize a long-term recovery and a new normal for patient access to care. The bill in its current form, second reprint, clarifies that the definition of telehealth includes both synchronous and asynchronous interactions and adds audio-only interaction to the definition except as it relates to industrial insurance or workers' comp. It also temporarily requires third-party payers to cover telehealth services in the same amount as services provided in person except for audio-only interactions. And third, it also requires the Department of Health and Human Services to establish or to the extent that money is available and resources are available, to establish a data dashboard that allows for the analysis of data related to telehealth access. And Chair Carlton, there are no fiscal notes on this bill.
Okay, thank you very much. So with that, I think I need a couple of definitions. You've expanded my glossary this morning. So synchronous and asynchronous?
Sure. Asynchronous and synchronous technology.
Okay.
I think I want to try to defer to your counsel to describe that, because I am not sure that I am equipped to really accurately describe that. Or Deputy Dwayne Young, would you like to answer that question on how you would define asynchronous and synchronous technologies appropriately?
Certainly, Dwayne Young, Deputy Administrator for the Division of Healthcare Financing and Policy for the record. This refers to what we typically call before in NRS Chapter 422, store and forward. And this is where messages are left by the medical provider for the recipient to use at another part of their appointment.
And which one was that? So
That is asynchronous communication.
Asynchronous communication would be when I go online and ask a question of my provider online and then I get a response later. So there's no personal interaction, it's electronic interaction.
That is correct.
Okay, just wanted to make sure. And then the other one
And we-
is,
And we previously called that store and forward communication.
and
So
I wouldn't
it
have known that
encompasses
one
the
either.
synchronous-
Okay.
The synchronous and asynchronous, it was the original language in chapter 422 of the NRS when telehealth was passed in 2015 session. Store and forward is the same. It's a little bit more complicated in terms of the provider leaving you detailed messages and instructions that are congruent with your health plan or the plan of care.
And if I understand correctly, then if I was to go online, leave a message for my provider, I would get a response. That would be billable and reimbursable at the same level as if I had an in-person visit?
Deputy Administrator Dwayne Young for the record. So not exactly. So the asynchronous communication is designed to respond to the specific care plan. And so it would be detailed instruction from your provider that would be based off of some visit. So it wouldn't necessarily be you calling in and saying, this is my issue, and the doctor just sending you a prescription. That's not billable in the same equivalent. It requires that there actually be some sort of messaging related to the care plan in that visit and specific codes be billed, meeting those qualifications of those CPT.
Okay, thank you. I think I've got a little bit better handle on it. So with that, I'm going to turn it over to the majority leader. I believe she has some questions.
Thank you so much. And so what I just wanted to make sure that we were getting a clear picture of is kind of how this will all look and play out once the public health emergency ends, and kind of what we're codifying and putting into statute. So as I read I guess, what is CMS telling us right now about what we know about telehealth in the pandemic?
Deputy Administrator Dwayne Young for the record, and so glad for the question, Assembly Majority Leader Benitez Thompson. Madam Chair and Committee, just want to put this on the record in this side of the House as I put this on record in the Senate side. When we originally marched down this path during the public health emergency, the CFR that governed HIPAA privacy was run through the Office of Civil Rights through the Department of Health and Human Services. They had originally interpreted that CMR regarding HIPAA privacy to ban audio-only communications, as well as such modern technologies such as FaceTime, Zoom, all of those others. And so the CMS then issued guidance at the onset of the pandemic saying that they were suspending the HIPAA rules, and that rule governed by the Office of Civil Rights. They actually did not have jurisdiction to do that. And so the Office of Civil Rights decided to just not enforce those rules. And so we as a state, because we had language in the NRS specifically blocking out audio-only telehealth, as well, and we were silent following the federal rules in terms of HIPAA privacy, we released additional guidance through COVID, allowing these flexibilities through the relation of the public health emergency. CMS has since come back and put publicly on the record, along with the Office of Civil Rights, that it is really not a regulatory change that needs to happen. It was really the interpretation behind their guidance. The Office of Civil Rights has released new guidance that says providers must maintain reasonable amounts of privacy in order for providers, but there is no restriction or prohibition on audio only. And so the only remaining prohibition or restriction would be that which is governed in NRS Chapter 422 for Medicaid reimbursement. And so that's what this bill seeks to do, is to align us now with that new federal guidance.
Thank you. And that's specific to where we see language throughout the bill that says, quote, that except for services provided through the audio only interaction. So that's where that language is coming from, as that conversation that you just had, or that information you just had.
Yes, correct. That provision of the bill, again, Dwayne Young for the record, that provision of the bill does two things. It one, introduces audio only into the text and strikes it out where it's prohibited earlier in the bill. And then it also has a requirement that while the division does pay at parity, because our chapter requires telehealth for Medicaid to be paid at payment parity, it does require payment parity for audio only. It does not do that. I apologize. While we have done that and we continue to do that, the provision allows us the flexibility to not do that. Hence, there's no fiscal note for increased utilization, so that if we ever end up in a crisis like we much were last summer during the special session, and we are deciding whether to take away prosthetics or cut rates, we have levers within policy where we could pay unequally between audio-only communications and other telehealth visits if the division needed to do that to make itself solve.
Thank you. And then one of the things I see here, so with the temporary federal regulations that allow for the expansion of telehealth through the public health emergency, all of those sunset when the public health emergency ends. And I think what I see from CMS is that they are doing some conscious thought around studying the economics of this, the modalities of this, and then the specific patient interaction, such as, does this make sense for an initial visit? Does this make sense for follow-up? Does this make sense for surgical patients? And so kind of, really looking more specifically at that continuum of health to say, and they're kind of open and saying, we will be looking forward to see where this is going to be the best fit. But I guess I don't see something across the board that says that we have the data and the research to, and I guess I'm getting more into the commercial insurance part of this versus the Medicaid piece, to say this is how we're going forward across the continuum of care. And so I guess is CMS saying something differently, or do we have more recent data and research about specific uses of telehealth? So I'll give you the example of the economics of the medicine, right? In most Medicare, Medicaid, you've got time increments that you can bill in. And I guess, they're looking at, what would be the standard inpatient time increment that people can bill for, whether it's 15 minutes or whatever, versus if you're doing something in telehealth, that might be 7 or 8 minutes. So are we going to end up in, overpaying because we don't understand the economics of the modality in which, and the difference between telehealth versus an inpatient one? But is there more data out there to help us understand that?
Dwayne Young, a deputy administrator for the division, for the question. Madam Chair, through you to the majority leader, Assemblywoman Benitez Thompson. I'm so grateful you actually asked that question, because it does allow me to clarify just some additional statements. The statements that I've made, yes, have pertained to Medicaid. With Medicare, what you will see is some national legislation moving forward to define better parameters through Medicare for telehealth. Many of the prohibitions that are existent within federal regulations and federal statute are actually applied to Medicare and not Medicaid. And so what you will see is, and that will have an impact that will trickle down to commercial plans because of those Medicare Advantage plans that are run through commercial providers. And so you're seeing some movement in the federal legislation to really define further parameters. I think that this discussion is twofold, and obviously I can speak for the Medicaid portion, as Medicaid has been the nation's leader in Nevada. Medicaid has been the nation's leader in telehealth as far as the open-endedness of its policies, and that's really built because of our rural and frontier areas. We're certainly reliant on telehealth, and so we had a very open policy that allowed services, as long as they met medical necessity and need and were performed to the same standard and quality as care as in-person services, could be performed via telehealth. And so one of the things that we are doing as a state is participating in the Western States Compact, and we are doing a study with other states to study this within Medicaid, and how does that translate to the other markets? How does that translate across other payers? And understanding first and foremost that the decision from telehealth should be a decision between the patient and the provider. Patients shouldn't be driven there as a cost savings measure, but really one out of necessity to get them their needs met and their treatment, certainly in areas where there are no providers. But also it should have a reasonable standard of care that applies that medical necessity and meets the qualifications of whatever CPT code that is being performed. And so we as a state will continue to study this in the Western States Compact. You will continue to see movement at the federal level addressing Medicare and the Medicare Advantage plans. And I think you will see that trickle down to the commercial plans.
Thank you so much. As I see it, and I'm looking at the back half of the bill because the front half is dealing with Medicaid, but the back half is in, I think, the commercial chapters. Isn't that right? So we understand that there's been, and that's what the data has shown us from 2015 to 2019. There's great studies on the CMS site about the use of telehealth in specific certain circumstances, and then rate parity there, right? That, or we'll say that rate parity, but an equivalent telehealth to face-to-face. So for underserved populations that are rural, where you might have an insufficient supply of medical providers, some behavioral health stuff, like those have been studied really, really well. I guess can we talk a little bit more about when we broaden it and we put this concept of payment parity into the commercial insurance chapters? And I don't expect, Mr. Young, I don't expect you to have to answer this, but I guess, do we know how it plays out there, going from kind of the specific way in which we've been applying and using this tool to making it across the continuum of care?
Thank you so much for the question. Sarah Shulhagian, for the record, through you, Madam Chair, to Assemblywoman Benitez Thompson. I would say that we don't know, but what you could look at in the way the bill was modified in the Policy Committee and Assembly Health and Human Services is that, and in my testimony earlier, is that the payment parity portion for the commercial side is now, the language has been changed and revised to make it a temporary payment parity. And so the parity requirements for telehealth services on the commercial side will expire 1 year after the date on which the public health emergency terminates, but no later than June 30th, 2023. The amendment also required an exception for behavioral health services if that expiration date is before June 30th, 2022. In this case, behavioral health services provided through telehealth will continue to be reimbursed at the same rate as in-person services until June 30th, 2023.
And on the commercial side, that's all services. So once again, when I look at CMS and I look at things they're exploring, that's surgical, that's onboarding. So hypothetically, you could have a patient go through quite a bit of the continuum of care completely through telehealth, and there would be that financial incentive to do that.
Mm-hmm.
Okay, with that, other questions at this time? I did have one more, and I just wanted to make sure that I understood it. That the initial visit can be set up through telehealth. Is that only during the public health emergency, or is that ongoing language all the way through? We've had a number of discussions about that in different bills this session relating to all different types of topics. So is that initial visit through telehealth that limited time, or is it fully extended?
Deputy Administrator Dwayne Young, for the record. The initial visit, and it really depends upon the service, but if it is a primary care initial visit, most behavioral health initial visits, that can be established through telehealth. Where we have had a divergent discussion is when we are introducing someone into opioid-assisted medication-assisted treatment. And so how to handle that initial visit has a different set of guidance, but that initial visit, whether through telehealth or initiated in person, that choice has always been available in Nevada Medicaid.
Okay, thank you very much. Any other questions from any other committee members at this time? Dr. Titus.
Thank you, Madam Chair. Mr. Young, thank you for being here. Thank you for the presentation. I still have some concerns about the process of audio only. And would you clarify, because out in the rurals, most folks don't have that smartphone, or if they do, it doesn't always work in their home or in their community. And I've been reading through where it clarifies because it's a pay issue, whether they get the provider gets reimbursed for the audio only, and I'm seeing that they would, but can it be the old-fashioned dial-up phone still? So it doesn't have to be a smartphone where they can interact. It could be the old dial-up phone, which we still have in my community, and some people still know how to use it. Will they get reimbursed for that?
Dwayne Young for the record. Madam Chair, through you to the Assembly Minority Leader, Dr. Titus. Yes, the language originally in Chapter 422 that has been struck out by this bill replied to standard telephone, but audio only is just a better term to encompass that. So it doesn't have to be a smartphone. It can be your standard landline that visit can occur through, as long as the provider can establish some reasonable privacy as a way to assuring that that patient is able to speak free.
Well, just so you know, thank you. Follow up on that one, Madam Chair. Mr. Young, just so you know, out in the rules, we don't have to use that community phone where we say, hey, Maggie, no, sorry, I didn't mean to use that reference, but hey, Barbara, would you just dial in 411 for me and get that next person down the line that everybody in the town would listen? We don't do that anymore, even in my town. So thank you. Hopefully we can establish privacy. Thank you, sir.
And thank you, Dr. Titus. If I could just have one brief follow-up in the conversation in thinking about what the majority leader was asking, and I'm thinking about some of the seniors that I know of and some folks that may not be technologically savvy. I mean, I still have to have people show me how to do a lot of different things. Thank goodness I have a very young executive director where I work that can make sure when I break my computer, she can put it back online for me. Are we going to, on the commercial side, are we going to be forcing people to do telehealth? Will they still have an option to go in? Are they going to be told that they have to do this? And what happens when they can't figure out how to do it? With the audio only even. So I would just hate to see folks be told, this is the only way you can access your health care. So if somebody could address that, because I can think of some of my seniors, they're not going to want to talk to some stranger on the phone that they have no idea who they're talking to. They want to look that person in eye to eye and know what's going on. So I'm just kind of curious about that.
Sure. Thank you so much, Chair Carlton, Sarah Shulhagian, for the record. I can tell you that the intent behind this request was really to encourage providers to use virtual care alternatives as a way to increase access to care. There wasn't a dialogue in switching, saying that this would take precedent over in-person. It's really allowing for greater access and another alternative way for them to provide care to all of their patients. That specific question related to providers then using telehealth services as our primary point of care was not something that was discussed. It was really in the spirit of making sure that there was an alternative care access for patients.
Okay, and I would just hate to see folks go the other way and not allow people to make that appointment and go in. So I'm just putting that on the record right now. I understand during the pandemic and with the healthcare crisis, we needed to figure out how to get things done, but there's something about sitting in the chair across the table from each other in an exam room that the primary care physician or provider can probably get a lot more from a person just by looking at them and having that conversation than just by having a phone call with them. So, Majority Leader?
Yeah, and I think that's the biggest piece I worry about. I just want to make sure we're being eyes wide open on this, is we haven't studied the economics of it, and CMS is saying we haven't studied the economics of it. They're saying very clearly, through research on their website, that they cite one clinic in Oregon that went from a total of 1,500 telehealth visits in a year to 20,000 in a month, right? Or sorry, like 15,000, that much in 1 month, and they don't understand the economics of it. So if a provider is going to be reimbursed just as much for a televisit as they are for an inpatient visit across the spectrum for every intersection of care and every point of care, then how does that affect healthcare economics? And it's something we're always talking about. But if with the telehealth, you don't have a brick and mortar component like you do when you have the inpatient. And so anyone who is in for-profit healthcare will pencil this out and will realize that there's a financial incentive for their bottom line to push more and make sure they have heavy services on telehealth. And as you know, I just wonder if we're really seeing how that's going to look. And so that's why for the private insurance side, I'm so concerned about this, because I just, CMS has put certain provisions in place specific to the healthcare emergency, saying like, this is how we have to pivot, this is urgent, but they're also saying full well, we are going to be looking at this and studying at this. I think that within a year and a half, CMS is going to come back and say, we've been collecting all of this data. We know better now where we want these intersections to be happening, where data and evidence tells us that it's happening the most effectively and the most efficiently, and then move forward with plans. But with us extending 1 year past the end of the health emergency, we're going to be out of line. So if we're making decisions and we say we want them based on evidence and science, I just want to make sure we're acknowledging it. We don't have it for that piece yet.
Absolutely. Thank you so much, Chair Carlton. Sarah Schulhagian, for the record, through you to Assemblywoman Benitez Thompson, I really appreciate this dialogue and your desire to make sure that this is following the intent of what the Commission wanted in the spirit. And the discussion that the Commission had when they were thinking about this measure was really around increasing access to patient care for the long-term recovery, recognizing that you have seen data-driven pieces of access for patients utilizing healthcare in tremendous numbers via telehealth, and saying this is a new normal and we want to make sure patients have continued access to care. There were some other parameters put in that discussion. For instance, the audio only provision. There was a carve out to recognize that you want that as an allowable modality, but there isn't payment parity for audio only interactions. And those are some of the safeguards that were discussed with the Commission and a part of this request. But I do appreciate your perspective and desire to make sure that it's good public policy and making sure it aligns with continued access for patients, increased access for patients. So thank you so much.
And thank you, Majority Leader, and thank you, Ms. Schulhagian. And as you started at the very beginning, there isn't an actual fiscal note, but as we've had this discussion, you can see what the possible fiscal impacts could be to the state and everyone else as this would move forward. So we thought it would be very important, because when we deal with PEB and Medicaid, being one of the biggest components of our budget, knowing where we could possibly be with that a couple years down the road, having this conversation, I think, is very valuable. Not every fiscal note points in one direction, and not every bill doesn't have a fiscal impact over the long run. So we always wanted to make sure have the conversation. I don't see any other questions from any other committee members at this time. So with that, this is the hearing. So we'll go ahead and open it up on SB 5. For those, is there anyone in the room here in support of SB 5? Not seeing anyone come forward. No one on Zoom. And thank you again, Mr. Young, for being here to help us with all of our questions. We appreciate that. Anyone on the phone line in support of SB 5?
If you would like to testify in support of SB 5, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 528, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Madam Chair, for the record, Barry Gold, BARRYGOLD, Director of Government Relations for AARP. Thank you so much for that great discussion on access, necessity, convenience versus profitability. So AARP, 345,000 members. We support the bill. Thank you.
Thank you, Mr. Gold. So with that, anyone else on the phone line in support?
Caller with the last 3 digits, 982, please slowly state and spell your name for the record. You will have 2 minutes. May begin.
This is Robin Rady, Executive Director of NAMI Nevada, ROBIN-REEDY. We support this bill. It saves lives. It has saved lives during the pandemic and can continue to do so. Thank you for your consideration.
Thank you very much. Anyone else in support on the phone line?
Chair, that was the last caller in support.
Thank you very much. Is there anyone in opposition in the room? Seeing none, no opposition on Zoom. Is there anyone in opposition on the phone line?
If you would like to testify in opposition to SB 5, please press star 9 now to take your place in the queue. Chair, we have no callers in opposition at this time.
Thank you very much. Is there anyone in neutral in the room? Not seeing anyone come forward. No one in neutral on Zoom. Anyone neutral on the phone line?
If you would like to testify neutral on SB 5, please press star 9 now to take your place in the queue. Chair, we have no callers in neutral at this time.
Thank you very much. So with that, I believe we can close the, Ms. Shohagian, any closing comments? Thank you very much for being here today and having the conversation. We do really appreciate it. So with that, we'll go ahead and close the hearing on SB 5. And I'll go ahead and invite the Chair of Health and Human Services up. I think we'll do SB 154 next. And just for my colleagues on the second floor, there's no reason to be in the room the whole time. I know we all have other things to do. We can make sure to give you a heads up so that you can make it from the second to third floor. So we'll try to get through as many of these. And for those who weren't here at the very beginning, the ones that we don't get through today will be automatically rolled until tomorrow. We just like to stack a day so that we can get through as many as possible, knowing some people will pull them if they're not ready. So with that, Senator Ratty, welcome to the committee. We'll open up the hearing on SB 154.
Thank you, Madam Chair. I appreciate the opportunity. Dare I say it, Julia Ratty from Senate District 13, dare I say it, this is a relatively straightforward, I won't call it simple bill, but it is an incredibly important bill when it comes to making sure that we are meeting the needs of Nevadans when it comes to behavioral health. So I want to introduce you to a term that is not my favorite term, but it is the Institution for Mental Disease. This is a federal term. And IMDs are agencies that serve individuals with serious mental illness or substance use disorder. And as a throwback to a prior time when we were trying to make sure that we didn't have too many people sitting in institutions, Medicaid put a cap on the number of beds that an agency that was providing a bed for somebody who has a serious mental illness or a substance use disorder, and said we will not reimburse any entity that has more than 16 beds. So if you are providing a bed for serious mental illness or substance use disorder and you have more than 16 beds, you're no longer eligible for Medicaid reimbursement. Over time, CMS recognized that that might have been pushing more cost into the Medicaid system, because if you can't get a bed, where you're going to end up, of course, is in the emergency room. And that is a much higher and more expensive level of care. And so basically what this bill does is it allows the state to apply for a Medicaid waiver. And if we can demonstrate that there is cost savings, then these agencies that provide services to people, again, there's two different components to the waiver, one for mentally ill, and the other for substance use disorder. If we can demonstrate savings within the Medicaid program, then, and that savings needs to be demonstrated, which is typical for Medicaid waivers over a 5-year period, then we can have a waiver to that, and we would be able to have these agencies start billing Medicaid for services. There would be a cost saving associated with that, because what's happening now, of course, is that folks don't get care, they escalate, and they become very expensive parts of our Medicaid system. So with that, I have so the process is we have to pass this bill, then we have to do the CMS approval process, and then there will be more beds for people in our communities. That's the very, very significant oversimplification of a Medicaid waiver process. With regards to the fiscal note, there is a $49,000 impact to stand up the process in fiscal year 2021-22, and then anticipated savings of $140,000 in the second year. So the savings in the second year offset the costs in the first year. And with that, I'll keep it brief for you and just stand for questions. And of course, Dwayne Young is here to talk about any fiscal aspects for Medicaid, and Dr. Woodard is here to talk about any of the behavioral health benefits that would come with the IMD waiver. Thank you.
And thank you very much. And I always found that term kind of uncomfortable also. It just harkens back to a very long time ago. So, committee members, are there any questions of the senator on either the overarching goal of the bill and or the fiscal note that is attached to the bill at this time? Thank you very much for the great explanation. We appreciate that. With that, this is the hearing, so I'll go ahead and open it up on SB 154. Are there others in the room in support of SB 154? Not seeing, yes, please, go ahead, come forward.
Thank you, Madam Chair, members of the committee. Joan Hall from Nevada Rural Hospital Partners in support of this. As Senator Ratty said, this does open up additional beds and is very important for our behavioral health clients. Thank you.
Thank you very much. Anyone else in support?
Hi, good morning. Valerie Padovani, Padovani, on behalf of the Nevada Psychiatric Association. We supported this in the policy committee and just wanted to say that we support this still. It's good policy and we look forward to it moving forward, hopefully. Thank you.
Thank you very much. Anyone else in support in the room? Anyone in support on Zoom? Seeing none. Anyone support on the phone line, please?
If you would like to testify in support on SB 154, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 982, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
This is Robin Reedy, ROBIN, REEDY, Executive Director of the National Alliance on Mental Illness for Nevada. We're here in support of the bill. This bill makes sense. It not only makes sense, it makes dollars and some. Thank you for your time.
Thank you very much. Anyone else in support on the phone line, please?
Chair, that was our last caller in support.
Thank you very much. Anyone in neutral in the room? Seeing none. Anyone in neutral on Zoom? Seeing none. Anyone in neutral on the phone line?
If you would like to testify in neutral on SB 154, please press star 9 now to take your place in the queue. Chair, we have no callers in neutral.
Thank you very much. So with that, I believe that concludes. Senator Ratty, you're more than welcome to come back for a two-sentence closing comment.
Yep, Julia Ratty, it's just gratitude. I want to make sure that there's recognition for the Nevada Psychiatric Association and Dr. Woodard, and literally thousands of behavioral health and mental health advocates at the national level who really pushed it for CMS, and at the state level. We've been working on this for about a decade. I'm just lucky enough to be hopefully sitting in the seat when we get it done. Thank you.
Thank you very much. So with that, we'll go ahead and close the hearing on Senate Bill 154. As we noted earlier, we're going to go ahead and go to Senate Bill 290. So we'll invite Senator forward on SB 290. With that, Senator, if you'd like to go ahead and proceed.
Thank you, Chair Carlton and committee members. For the record, I'm Roberta Lang, State Senator for District 7 in Clark County. I'm pleased to be here to talk to you about Senate Bill 290. This bill is about step exceptions and for cancer. In approximately 16,970 new cancer cases will be diagnosed in Nevada this year, and we are above the national average in cancer. And people face tremendous financial burdens when they get cancer for the medicines they have to take and the care that they need to get better. Generally, health insurers use step therapy to lower the costs. I'm going to give you an example of step therapy. I think the easiest way to understand it is through an example because it's very complex. Health insurance companies use step therapy programs to lower their costs. And so, for instance, if you had cancer, you went to the doctor and you were diagnosed with cancer, under the step therapy protocols by insurance companies, you would be required to take a step 1 medicine, even if you were diagnosed with a step 4 cancer diagnosis. And then if that didn't work and it didn't meet your needs, they'd move you to a step 2 and on to a step 3 or a step 4. Under my bill, it's called a step exception therapy. So if you went to the doctor and you were diagnosed with a step 3 or 4 cancer, your doctor would be able to ask the insurance company for a step exception and allow you to go directly to the step 3 or step 4 cancer medicines to treat your diagnosis. If the the insurance companies didn't agree with you, you would be able to file, there's an appeal process. I've been fortunate to work with the major insurance companies, with the doctors and the hospitals, and we collectively have agreed that this would meet the needs of patients in Nevada and be able to give people an opportunity to cure their cancer and have a life beyond, some people, 6 months, or generally the average time period is 4 years. So I think that this will be a really great opportunity for not only those people that are facing what could be death, to have an opportunity to have a life. And so as far as the fiscal note goes, when it came out of the Senate, it had no fiscal notes. Chair Carlton and rightly said it didn't include Medicaid patients. The reason I didn't include Medicaid patients in my bill this year is because I knew our state coming out of the pandemic didn't have a lot of funds, and I wanted to make sure that we got a start with this bill. And then my intention was to expand it in a couple of years when I was hopeful that our state would be in a different financial situation. I am, if we could add Medicaid patients earlier, it would be just that much better. And so thank you so much for hearing me, and I'm open for any questions.
Thank you very much, Senator. A couple of us were on Commerce and Labor when we had that hearing, so we are a little bit more familiar with it. So thank you for the walkthrough. This will have an impact on PEB. So I'm looking at the numbers for PEB.
Yes, and
Moving
Chair
forward.
Carlton, if I may.
Yes, please.
Initially, when the bill came out of the Senate, we did not have a fiscal note for PEB. The bill in its original form had no fiscal note. Then we made some changes because Clark County had asked for an exception, and so we made some changes and then later found out that we didn't need to make those changes, so we put the bill back in its original form. And as the bill came over to the Assembly, it picked up the fiscal note from PEB.
Okay, and that fiscal note from PEB is $713,000, is my understanding. So we have the document here. Thank you very much. So with that, there was a conversation in Commerce and Labor about including Medicaid patients, and the senator was gracious enough to allow us to have that conversation, knowing the philosophy of a lot of us in this building, that if we're going to provide treatment for folks, we want to make sure whether you access it through Medicaid, self-insurance, private insurance, and a health and welfare trust, that all cancer patients are treated equally. So I'm really glad that Mr. Young is here. So if we could have a conversation about, I know I've had a few offline conversations with folks about the step therapy. If I remember correctly, as far as Northern Nevada goes, this is not implemented there, so it wouldn't necessarily have an impact there, but I do believe it does have an impact on the Medicaid providers in Southern Nevada because it's through an HMO model. So, Mr. Young, do you have any numbers for us as far as what type of fiscal impact this would have on Medicaid if we included Medicaid in this bill?
Chair Carlton, Dwayne Young, Deputy Administrator, Division of Healthcare Financing and Policy for the record. If you may allow me just 30 seconds to just clarify and set up our fiscal note, then I will walk immediately into the numbers. I did just want to clarify on the record that this does impact those within the North and the South, as managed care is expanded to Washoe and Clark County. Would be no impact to fee-for-service. So certainly those residents within our rural and frontier counties as well as those who are in the traditionally age-blind, medically age-blind and disabled category, as well as the waivers are contained within fee-for-service. So this would have no impact on this, just those that are within our newly eligible aid categories in those two counties. The division comprised a fiscal note that looked at the total computable across fiscal years 2022 and 3, because there's some overlap within the years. Just for this committee's information, this note was estimated very much in the same manner that PEB did. It was a bit difficult. We did receive calculations from our largest MCO. One MCO did not reply, and the other did not feel that the provisions of the bill met to them. We did not agree with that assessment, and so we aggregated this note across the data of our actual membership of our current plans. I say this with a caveat. As you are aware, we are going out to RFP, and the composition of our MCO's plans could certainly change in 2022. As part of that RFP, there is a provision that the contracts are bidding on that calls for, in calendar year 2023, a unified PDL, which would fix this problem in Medicaid, as they would have to follow the same preferred drug list. And this note is calculated off the acceptance of non-preferred drugs over preferred drugs. So with that said, we have provided to Ms. Kaufman this data. We are looking at a roughly $750,000 in each year of the biennium. And so a total general fund contribution of $1.5 million over the 2 years of the biennium. There is no county fund impacts because, again, as I had mentioned earlier, the county waiver recipients are in fee-for-service, so there's no impact to the county obligation. This would be purely general fund.
And this would be the you said this would be the general fund. Would it draw down federal funds on top of it?
Yes, it would. The total computable obligation, and again, Dwayne Young for the record, the total computable obligation would be $10 million over the biennium. Because of the varying reimbursement, we'd actually see a significant kick in of 9.1 million in federal funds and just the 1.5 million in state general funds. So we'd see a very significant contribution from the federal government on this note.
And I think we want to make sure we say that again for the record. Cancer patients in Medicaid, if the state invests $1.5 million, $10 million worth of care will be given to these patients. Did I say that correctly?
Deputy Administrator Dwayne Young, yes,
Okay.
that is correct, Chair Caldwell.
I think that says it all in 2 sentences. So with that, thank you, Senator Lang. Are there any questions from any committee members at this time? Ms. Gorlow.
Thank you very much, and thank you so much, Senator, for bringing this forward. I'm not so sure we'll be able to answer my question, but we'll give it a go. If someone who has a stage 3 or 4 and they're automatically going to the stage 1 versus a 3, and it doesn't work, so now we've got to try 2 and try 3. That's going to be very expensive for trying all these different levels. When if we just went straight to the 3, I kind of see it as a cost savings with skipping those 2 levels. So do we have any idea of how many people that are stage 3 and 4 actually have to go up that ladder?
Thank you, Assemblywoman, for the question. I think that's part of the problem in trying to figure out what the fiscal note is, because we're not looking at all cancer patients. We're only looking at the cancer patients that go to the doctor. I go to the doctor today, and I'm diagnosed with stage 3 or 4. That's when I would jump and ask with my physician, jump to the stage 3 or 4. Those people that go to the doctor and they have stage 1 would automatically go on a stage 1 medicine. If that didn't work, then they'd put them on and they'd go through the progression. We're only talking about the group of people that go to the doctor and are initially diagnosed with the stage 3 or 4 and need to get to that medicine right away without having to go through the current protocols that the insurance companies have. I hope that answers your question.
I think it does. I think it shows that we could actually have some cost savings because we wouldn't be paying for that stage 1 drug and stage 2 drug, then paying in for that stage 3. If we would have went straight to that stage 3 drug, we would save those other 2 steps. So.
Right, and I'd also say the reason the insurance companies do the steps is because it saves them money. When you get to the stage 3 and 4 medications, they're very expensive, which is why we put into the bill if someone gets to jump to a stage 3, they'd only get a 1 week's worth of prescriptions because sometimes people's systems don't allow them to take that medicine and it's so expensive. We wanted to make sure that there was no waste. And so if they took it for a week and the doctor said it was working, then they could go and get the rest of the prescription. So I tried to find cost savings in being able to jump to the 3 or 4 medicines.
Wonderful. Thank you so much.
Mr. Levitt.
Thank you, Madam Chair. And so, in my understanding, does this legislation bypass the appeal process or attempt to eliminate the appeal process?
Thank you, Assemblyman Levitt. No, it does not. So in my legislation, if you went to the doctor and you were diagnosed with a stage 3 or 4 cancer, your doctor and you could appeal to the insurance company to be able to jump steps 1 and 2 and go right to the 3 or 4 medicine.
Follow up, Madam Chair. I guess I'm trying to see the benefit, you know, having a mother that passed away of cancer and passed away 3 months after she was diagnosed. An appeal process would do her no good. And so I'm trying to figure out how that logistically works out.
Thank you for that clarifying question. So if I went to the doctor and I was diagnosed with a 3 or 4 cancer, the appeal process, the insurance company has 72 hours to respond to you once you submit all of your documents. And I too had a father that passed away of cancer. They said he was trying to get those medicines. He was 48 years old. They told him he wasn't sick enough. He passed away 6 months later. So I think this is really important legislation to make sure people that are diagnosed with step 3 or 4 cancer have the opportunity to get the medicines that they need so that they can go on and live a life.
Thank you.
Thank you.
And thank you. I'll go to Dr. Titus, but I want everyone to keep in mind that we are on the clock and we do have a time certain to get downstairs. And I want to make sure that we open it up for public comment. We've gotten a lot of information. We'll allow more latitude when we do get to work session on this if there are any unanswered questions. But we are on a clock. Dr. Titus.
Thank you, Madam Chair. Just a quick question then. For me, it seems like this bill is bringing forward some common sense legislation in that it should always be up to your provider and the patient on what the best treatment is. And if we can alleviate that step that forces all the prior authorizations that then delays care, it just makes good sense to get the treatment as expeditious as possible without having to ask so much permission. So, you know, hopefully that it will maybe clarify that in the language that these, you know, it doesn't prevent the doctor from using stage, you know, the first tier if indeed that's appropriate. But if they at the point, based on their medical education and the patient sitting there looking at them, they could go right to stage 4 treatment or tier 4 if indeed that was the most appropriate for that patient when they make that healthcare decision. So hopefully that's where you're going with this, in an expeditious treatment.
Thank you, Dr. Titus. I agree with you 100%. That is where I want to go in negotiations with the stakeholders. This is kind of a gray area for them, something they haven't dealt with. They're not sure of the cost, and they felt like they wanted to go into it in a slightly slower pace. But I do hope that we can get to the space that you're speaking of. That is where I'd like to be.
And thank you, Dr. Titus. And with that, committee members, I'd like to go ahead and get to support opposition and neutral so that we can complete the hearing process. And then if there is other questions or conversation, I am sure that the senator will be available, and we are investigating the cost as far as it goes. There was a fiscal note for PEB. Do we have someone from PEB available to address that fiscal note at this time? Please come forward. And if you could get that on the record for us?
Thank you, Madam Chair. I am Laura Rich, Executive Officer of the Public Employees Benefits Program. I do want to put on the record that we do have a $713,000 fiscal note per year, as you had mentioned. The issue here is not, I want to clarify, again, I'm not I'm not a pharmacy expert but from the conversations that I've had from or with our pharmacy benefit managers, the issue here is not the stages of cancer. It's formulary versus non-formulary. So if a cancer patient is diagnosed and is provided a prescription drug by their provider, that prescription drug is potentially not on the formulary. It is not on the PBM's formulary, and there's an alternative which is on the formulary. And so what the PBM does in these cases is requires the patient to try that formulary drug before the more expensive non-formulary drug. And so there's an appeal process if the provider does not think that alternative drug is not appropriate. They do have an appeal process in place where that can take place. In discussions, I had asked our PBM how many folks actually, when they get this alternative, less expensive drug, how many stick with the less expensive drug, and how many go to the original drug that was prescribed. And about 80% of them do stick with that less expensive drug. It works for them rather than going back to the non-formulary drug. So that's where those costs are, and that's where those savings are, and that's where that $713,000 fiscal note is.
And thank you very much. We appreciate you being here to answer that question. I believe that's probably true, whether it's 1, 2, or 3, anywhere in the continuum of this, that would be the same argument. So I believe you would have the same issue, no matter what the diagnosis and what the drug was. That's just that natural tension between provider and formulary. So, but in looking at this and the number of patients it may possibly impact, that's how you derive the number of $713,000 per year.
That is correct. Laura Rich, for the record, that is correct. Again, we were not able to differentiate because we don't have, PEB doesn't get the diagnosis information, so we cannot differentiate between stage 1 and stage 3 and 4. So this includes all cancer patients.
All right. So I think I've got it. Thank you very much. Just wanted to make sure. So with that, thank you very much, Ms. Rich. We appreciate you addressing the fiscal note. So with that, we'll go ahead and hold on for just a second. So Ms. Rich, here's the $60,000 question no, it's actually $713,000 question. Would you be able to absorb this within your reserves at this time? Or would this need a general fund appropriation? And I'd like to discuss that for both years. It's not one for all. If you could absorb it the first year and need the general fund appropriation for the second year. If you can't answer that at this moment in time, not sideswiping you, just want to make sure you know where the question's coming from.
Laura Rich, for the record, that's actually the $30 million question. We have, because of COVID suppression, where people have just not been going to see the providers, they haven't been going to see the doctor, people have not been able to seek services in the last year, and so we've had claim suppression. So PEB does have a significant bucket of reserves at this time. However, I just last night got the new numbers, and things are going in the opposite direction as we had anticipated, where we're seeing a lot of utilization. And so if that continues, those reserves will be drawn down. How much of those reserves are we going to use? That's the question that we don't know. COVID is an anomaly. We didn't expect to have $30 million of excess, as of, we didn't expect to have any excess as of last year, and so now we're dealing with a $30 million excess bucket. But I see that as a temporary excess versus something that we have to draw down. So it's hard to answer that question, is my answer to that.
Okay, I think I'll come up with an answer for you.
Okay.
Okay, thank you very much. We appreciate that very much. We've had conversations about the reserve. We understand where utilization was, where utilization might go. We're not looking at $5 or $10 million. We're looking at $713,000 in each year, which really is like a very small bump in the road for a plan the size of PEB. So we'll have future conversations about it and make sure that we can do something that we believe will be very responsible moving forward to not cause any harm in the long run. So thank you very much. We appreciate you being here. So with that, I think we need to go ahead and open it up for support, opposition, and neutral. Senator, if you would go ahead and step back. Thank you very much. We appreciate that. So anyone in the room in support of SB 290? And for those others in the room right now, since we have a time certain, we have to go, there'll be no more bill hearings today. When we finish today, we will be adjourning. So anyone in support of SB 290? Not seeing anyone in the room. Anyone, no one on Zoom. Anyone in support of SB 290 on the phone line?
If you would like to testify in support on SB 290, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 582, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Chair and members of the committee, my name is Jaron Hildebrand, and I'm the Executive Director of the Nevada State Medical Association, calling in support of SB 290, and just quickly wanted to thank Senator Lang for all of our hard work, and we are in support. Thank you so much.
And thank you very much. Anyone else in support on the phone line?
Caller with the last 3 digits, 653, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Madam Chair Carlton. This is Dora Martinez, DORA-MARTINEZ, representing Nevada Disability Peer Action Coalition. We are in support of SB 290, and thank you to Senator Lang. Have a great morning.
Thank you very much, Ms. Martinez. Next caller in support, please.
Chair, that was our last caller in support.
Thank you very much. Is there anyone in opposition in the room? Seeing none, no one on Zoom. Is there anyone in opposition on the phone line?
If you would like to testify in opposition to SB 290, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition.
Thank you very much. We'll go to neutral. Is there any neutral in the room? Seeing none. Is it no one on Zoom? Any neutral on the phone line, please?
If you would like to testify in neutral on SB 290, please press star 9 now to take your place in the queue. Chair, we have no neutral callers at this time.
Thank you very much. Senator Lang, thank you very much. Did you have any closing comments?
Just one quick comment, Chair. Thank you so much. I think this is really important for people that are diagnosed, and I just want to make sure that everyone understands we're only talking about the people that are diagnosed stage 3 and 4, not all cancer patients, because if you're diagnosed with 1 or 2, you go through the step protocols already by the insurance company. So we're talking about just the step 3 and 4, and thank you so much, and I look forward to you supporting the bill.
Thank you very much, Senator. So with that, we'll go ahead and close the hearing on SB 290. There are future conversations that are going to happen, and as I said earlier, because we did kind of go through this one quickly, if there are more questions that need to be asked, we'll be sure to give the committee plenty of time with that. With that, the last item on our agenda for today is public comment. Is there anyone in the room wishing to make public comment at this time?
Kent Irvin, Nevada Faculty Alliance. I'll make it very quick. The most regressive cuts to state employees' pay and benefits has been the cuts to the PEB program, which we just had the discussion about, the excess reserves. Those arise from 3 things. Part is the claim suppression, but there's also the fact that premiums for employees were increased by about 42% to 24%, depending on your plan, in this current fiscal year. So that money came in, COVID was actually paid for, much of it by the federal government. That's the second thing. And then the claim suppression is the third thing. So that may or may not be a temporary, and some of it has the excess reserves may or may not be temporary. Some of it has already been allocated by these committees. But for fiscal year 2023 with the American Rescue Plan funds, we need a full restoration of the PEB benefits. Thank you.
Anyone else with public comment in the room? Seeing none, is there any public comment on Zoom? Seeing none, is there any public comment on the phone line?
If you would like to make public comment, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 064. Please slowly state and spell your name for the record. You will have 2 minutes and may begin. Caller 064, please press star 6 to unmute.
Hello, good morning. Thank you, Madam Chair, for taking my call. My name is Deborah Von Arx, DEBORAH, last name VONARX. I am in support of AB 351, the End of Life Options Act. I am a Reno resident and I have cared for both of my terminally ill parents. My father's care lasted 11 years and it was one of the most challenging times of my life. As a former hospice volunteer for St. Mary's Hospital and a loving daughter, I can speak firsthand to this matter. I am urging you to move this bill forward. There are terminally ill Nevadans standing by right now desperately in need of this option. 73% of Nevadans polled are in favor of this option. It is irrefutable. What I don't understand is why there has been a disrespect and why it has been off the agenda for so long. This is not how democracy works. The majority of people speak and the legislators hear their intentions. Where did this breakdown come from? If you have any compassion at all for this issue, we are urging you to move this bill forward. We are still fighting and will continue to fight for terminally ill Nevadans. This is a human rights issue, not one that should be overlooked in this way. We should all have this right when the time comes at the end of our life. I'm hoping you make the right decision regarding this bill, and thank you very much for your time.
Thank you very much. Is there another caller for public comment?
Chair, that was the last public comment caller.
Thank you very much. So committee members, this is going to be a rarity that we actually adjourn this early in the day. So enjoy the rest of your day. And this evening, we'll all be seeing each other again this evening. So with that, we are adjourned for the day.